Okay. Okay. Hi, everyone. Thank you for coming and being with us today. I am Lindsay. I am one of the nurse practitioners here at Fort Wayne Peds, and my coworker, Casey, is also going to be helping present. So we are really excited to talk about something that's so super important in keeping our kids healthy. So here are our goals for tonight. We essentially just want to share clear and accurate information about vaccines. We want you to feel confident in the decisions that you are making for your children based on the evidence-based recommendations of your provider. So this is our vaccine policy at Fort Wayne Pediatrics. We strongly support the recommendations of the American Academy of Pediatrics, the CDC, and the state of Indiana. And this is our policy for several reasons, but most importantly, it's just protecting our patients here, protecting the children that come here, their families, and our vulnerable patients who are at risk. And that, again, extends beyond our practice here. So I'm going to hand it over to Casey.
Can you second and see if everyone can see on Zoom?
Sure. See us?
See the oh. So to say you're not going to be able to see the presenters, you're just going to be able to see the
yes. Sorry, for today, you will not be able to actually see Lindsay and I talk, but you'll be able to see the slides. And we are going to try and save questions towards the end, just for sake of time. But if you need anything, you can always raise your hand or message, and Christy will let us know if there's something going on with Zoom and you can't hear us or see the slides. Okay, so let's get started. So virus or bacteria, vaccines prevent against both viral and bacterial diseases. Moving forward in the presentation, I'm going to use the word pathogen interchangeably with virus and bacteria, just referring to these diseases, to these pathogens that can cause disease in a host organism. Viruses are, next page. Viruses are smaller than bacteria and require a host cell to reproduce. On the other hand, bacteria are living organisms and they can live both inside and outside of a host. When we think of like a host for today's purposes, we're going to think of a child. Bacteria are everywhere. They are in the dirt. There's actually over 40 million bacteria in 1 gram of soil. Bacteria are on your skin. They're in your gut. Both pathogens, so both virus and bacteria, can spread through respiratory droplets, bodily fluids like saliva, contaminated surfaces, or through direct contact. Both virus and bacteria can trigger an immune response and can be prevented through good hygiene, like hand washing, covering your mouth when you cough, and vaccination. Both can lead to severe complications if untreated, including organ damage or death. This slide is very busy, but I like it because we talk a lot about antibiotics in our office. And I think sometimes people forget that vaccines prevent against bacterial diseases too, not just not just viruses. While antibiotics are essential and commonly used for treating bacterial infections, vaccines still provide the best defense from a bacterial infection by preventing the infection from even taking place. Basically, prevention is better than treatment. Relying only on antibiotics increases the risk of antibiotic resistance and doesn't guarantee protection against severe or untreatable bacterial disease. We'll talk later about Haemophilus influenza type B, which is a type of bacterial disease, and how widespread vaccination helps significantly decrease the prevalence of that disease in children under 5 years of age. Let's talk about ingredients. One of my favorite statements is everything is chemicals. This reiterates that all organisms, including our children, and they are living organisms, are composed of chemicals. We determine if a chemical is harmful or toxic depending on the quantity of that chemical. So hopefully we can provide some clarity and comfort that vaccines are not toxic and do not contain toxic chemicals. Vaccines contain several key ingredients. So I think this is a great picture that kind of shows the key ingredients or the key components of what's in a vaccine. So we have the active ingredient, the adjuvants, residual traces, preservatives and stabilizers, and water. So each component serves a specific purpose, and each ingredient is tested and closely monitored during the manufacturing process. So if I can turn, most of you have probably at least heard of the word antigen. Antigens are the active ingredients in the vaccine. So the antigen may be a small part of the disease-causing organism, or it may be the whole organism in a weakened or an active form. The number of antigens used in vaccines has decreased significantly. So in the 1980s, there were 15,000 antigens in vaccines that were used to prevent against 8 diseases. Today, we have fewer than 200 antigens in vaccines, and we prevent against 16 diseases. So for those good in math, that is a 97% reduction in antigen content, which is pretty amazing. And that is just because of advancements in science and manufacturing technology. So the importance of antigens in a vaccine is explained in this slide. So in order for your body to have immunity against a disease, your body needs a specific and unique antibody to fight that pathogen. So if a new pathogen enters and you don't have an antibody, that is when you have signs and symptoms of that disease. So for example, with the measles vaccine, the measles antigen is introduced in a live virus vaccine. It gives the body a weakened form of the virus, which allows the body to slowly build a defense of antibodies. So if a child is exposed to the measles virus in the future, they have a unique antibody already stored in their immune system to target that pathogen. All right, we are going to attempt to play a video, and we will see how it goes. An adjuvant improves the immune response to the vaccine, sometimes by keeping the vaccine at the injection site for a little longer, or by stimulating local immune cells. Not all vaccines use adjuvants, but an example of an adjuvant is aluminum. And that is something that we hear a lot about in the office, questions about aluminum, which vaccines are they in? So I'm going to let the expert, Dr. Paul Offit with Children's Hospital of Philadelphia, explain a little bit more about aluminum. Can you guys hear it?
My question is, why is aluminum in vaccines? Isn't it dangerous?
So the reason aluminum is in vaccines, and has been really since the 1930s and 1940s, is it serves as something called an adjuvant. So by adding aluminum, what that does is that makes the vaccine more likely to induce an immune response. It also makes it so that you can give fewer doses of the vaccine and also lesser quantities of the vaccine. So then the question becomes, is it harmful? And you should realize that assuming you live on the planet Earth, you're going to be exposed to aluminum salts in water, aluminum salts in the food that we eat, and at far greater quantities than you ever would get being exposed to a vaccine. Now, a parent could say, yeah, but isn't it true that if you eat aluminum or drink aluminum salts, that a lesser quantity of that is absorbed from the intestine into the bloodstream than if you inject it directly into the arm, in which the case the body doesn't have any chance to reject that aluminum. And that's true. I mean, by definition, 100% of the aluminum that you give as a vaccine is going to be absorbed, whereas only about 1% of what's taken by mouth, either in the water we drink or the breast milk that we drink or the infant formula that we drink or the food that we eat is going to actually then go from the intestine into the bloodstream. That is true. It's only about 1%, but there's so much more in what you drink and what you eat than you're ever going to get from a vaccine that you can't tell that anybody's gotten a vaccine that has aluminum in it. In other words, studies that have been done looking at people who get aluminum-containing vaccines that then look at the blood levels of aluminum to see whether there's clearly been a bump in the aluminum then that is in your bloodstream doesn't show a bump because you are eating or drinking so much aluminum on this planet. So it isn't harmful. The only place in which aluminum really is harmful is in people who have kidneys that don't work well or don't work at all. And that's where it can be a problem. And only in that situation, it's when you're taking sort of things like antacids that contain large quantities of aluminum that can be a problem. So hopefully that helps.
Thank you, Dr. Paul Offit. I think it helps. Okay, moving on. So I'm sorry this graph is a little blurry, but you can see in the bottom, it shows vaccines and it has the number 4. So that is 4 milligrams of aluminum that a baby is exposed to in the first 6 months of life. So that is all the vaccines that a baby receives in the first 6 months of life. And that is the amount of aluminum aluminum in all those vaccines. So you compare that then to breast milk. So breast milk in the first 6 months of life that a baby ingests, there's actually 10 milligrams of aluminum. So far more a baby is getting from breast milk than from with vaccines. So another component in vaccines is preservatives. So preservatives prevent the vaccine from becoming contaminated once the vial has been opened. So this is only for multi-dose vials, and the preservative just ensures that bacteria or fungi don't grow inside that vial. So obviously not all vaccines have preservatives because they are stored in 1-dose vials and then are discarded after that single dose is administered. The most commonly used one is actually 2-phenoxyethanol, but the one that we talk about the most, or you have probably heard about the most, is thimerosal. So that is a type of mercury that does not stay in the body. It's a type of mercury called ethyl mercury. It's different than the mercury that if you have too much of it from fish, it can make you sick. So thimerosal was removed from childhood vaccines as a precautionary measure, not because evidence indicated it was harmful. The reduction was part of a broader effort to minimize mercury exposure from all sources. And then obviously the transition to single-dose vials for many vaccines also eliminated the need for the preservative. Countless studies have shown that there is not a correlation between thimerosal and autism plus the MMR vaccine, which is brought up a lot incorrectly as a driving force for the increased incidence of autism never contained thimerosal. Okay, so the next component of vaccines is residuals. So residuals are tiny amounts of various substance used during manufacturing or production of vaccines that are not active ingredients in the completed vaccine. One of those things are antibiotics. So antibiotics are used to prevent bacterial contamination during production. The types of antibiotics that are most likely to cause immediate allergic reactions in children, such as penicillin, are not used in vaccine production. Egg proteins may also be present in some vaccines because chicken eggs or cells are used to grow the viruses. Most of the egg protein is removed, and people with egg allergies can safely receive routine vaccines. Yeast protein may also be present, but while the vaccines are purified, most of that yeast is removed from the final product, sorry. Okay, one of the most commonly talked about residuals is formaldehyde. Formaldehyde is an essential component in human metabolism and is required for the making of DNA and amino acids. So if you are a living organism, you have formaldehyde in your blood. We all have detectable levels of formaldehyde, including children. It's used in vaccines to inactivate viruses and detoxify bacteria. Almost all formaldehyde is removed during production of vaccines, and the residual amount is far less than what occurs naturally in the environment. Normal formaldehyde blood level is 1,500 times more than what is received in any one vaccine. I always like to use the pear. So there's about 60 times more formaldehyde in a 100-gram pear than in one vaccine. Dr. Paul Alfit has a great video about this, but for time, I'm not going to show it, but you can find it on the CHOP website. So we reviewed antigens, adjuvants, preservatives, residuals. Surfactants are another ingredient. They're just used to keep everything like stuck together. Surfactants are also used in ice cream. And then another one is a diluent. Did I say it right? Diluent is a liquid used to dilute a vaccine. The most commonly used is sterile water. Okay, we reviewed what is in the vaccine. So let's discuss the different types of vaccines. This is also from the Children's Hospital of Philadelphia, but it gives a very simplified example of the different types of vaccines used that are administered to children. And just to reiterate, the goal of all these vaccines are to safely mimic disease while building immunity. So the first one we're going to talk about are vaccines that weaken the virus. And these are live attenuated vaccines. So it contains a weakened form of the pathogen. The pathogen is attenuated, meaning it has been modified to reduce its disease-causing ability while retaining its ability to stimulate an immune response. So basically, you get the benefits of a natural infection without the complications or side effects of that disease. Because they imitate a natural infection, they have longer-lasting immunity, usually just after 1 to 2 doses. The other type of vaccine are vaccines that inactivate the virus. So in these, the pathogens are killed or inactivated using heat, chemicals, or other methods. This process preserves the pathogen's antigens, allowing the immune system to produce antibodies when it's ejected into the body. Booster shots are often needed to maintain long-term protection with these types of vaccines. But the pros of these is that people who are immunocompromised can safely receive them. The third type is vaccines that use part of the pathogen. These include subunit, conjugate, and toxoid vaccines. Subunit vaccines show the immune system exactly what to target by using protein or sugar molecules from that pathogen. And examples of those are the hepatitis B and HPV vaccine. Now, certain bacteria like Haemophilus influenza type B and pneumococcus have a polysaccharide layer or polysaccharide capsule. It's part of the outer envelope of the cell wall of the bacteria. So this cell wall layer, or this layer around the cell wall, protects the bacteria from the environment and from the host cell's immune system. So in other words, it's like an invisibility cloak around the bacteria. And then let's say you have a child's immune system, that bacteria comes in, the child's immune system cannot see that invisibility cloak and it cannot attack that organism. So then what a conjugate vaccine does is it takes a protein and attaches it to that cloak, and then it is no longer an invisibility cloak, and the child's immune system can recognize it and then create antibodies. Toxoid vaccines inactivate the toxin. We have, for example, like the tetanus has a toxoid. And so what a toxoid vaccine does is it targets that toxoid rather than the bacteria directly. The fourth kind of types of vaccine are vaccines that use part of the genetic code. These include both viral vector vaccines and mRNA vaccines. An example of a viral vector vaccine is the Ebola vaccine and the AstraZeneca COVID vaccine, which we do not administer to children. An example of the mRNA vaccines are the Pfizer and Moderna COVID vaccines. So let's talk a little bit more about this because sometimes we have a lot of questions, or there have been a lot of questions or kind of pushback with the COVID vaccines because people are kind of unfamiliar with how mRNA vaccines work. So I like this picture because it kind of helps, but even though they are new to the market, they have been studied, I believe it was since like 2007. Yeah, 2007. So these types of vaccines contain messenger RNA, which are molecules that show the cell how to make proteins. The mRNA teaches the cell how to make a protein from the pathogen. So that protein is introduced to the immune system, triggers a response, causing the body to develop immunity to the pathogen or to the virus. I think it's important to stress that mRNA vaccines cannot affect or interact with your genetic material or your DNA. It is impossible for them to do that. The mRNA from the vaccine does not enter the nucleus where the DNA is located, because once the mRNA is introduced, it's quickly broken down and then eliminated from the body. Okay. So we've talked about the ingredients in the vaccines, the different types. Let's take a step back and talk about immunity. There are three types of immunity: active, passive, and community. Vaccines are a type of, what type of immunity? Active. Good job, Lindsay. So active immunity does not provide immediate protection, but requires days to create antibodies. When kids get vaccines, they are not immediately protected. It takes weeks for them to build antibodies to protect them against that pathogen. Going to passive vaccines. In passive immunity, antibodies are given to the infant or child. So examples of this is if a mom receives the Tdap vaccine at 28 weeks gestational age, then those antibodies are passed on through the placenta to the baby. So that is one type of passive immunization. The other type is our RSV monoclonal antibody that we now have. And then the third type is breastfeeding. What, is that right? Yeah? Good? Okay, good. Okay. Oh, thank you. Okay. All right. Community immunity. So this is the least reliable form of immunity. So under that, we have cocooning. So that's basically when you would ask like grandparents to get the RSV vaccine, get updated on your flu shot, get your Tdap booster so you protect the baby against pertussis. Herd immunity is probably something we've all heard of before. As more people become immune in a community from that pathogen, it's less likely that that pathogen or that virus or bacteria is able to latch on to anyone. And then there are hopefully fewer outbreaks. So levels of herd immunity thresholds vary disease to disease. Who knows the most contagious vaccine preventable pathogen?
Measles.
Oh, good job. Bradley Frayne in the front row. Okay. Because measles is one of the most contagious pathogens known, a community requires almost everyone to be immune in order to stop its transmission. So this is kind of just reiterating what I just said. But I always see if I can get here. Oh, this might be kind of small, but I want to show you the current Allen County rates for our vaccines. You might not be able to do that, will you?
Yeah. Can you see?
Basically,
nope.
No, okay, that way?
Yeah. Yep.
Okay. Maybe. I know. I mean, you can find this at indiana.gov/health/immunization. Okay. Anyway, so we can see that even if you can't see it, I will tell you the measles, mumps, rubella rate is 81.9%. That is abysmal. So, and if we go back to our slide, that does not meet the community immunity threshold that is required to prevent a measles outbreak. Okay. Moving on. I know my papers. Okay, we are going to talk about vaccine safety and development. So there is a lot that goes into when a vaccine is developed. It can take many years and there's many steps for it to finally come to our office before it's administered to a child. So the first step is research and discovery. Scientists can spend 10 to 15 years researching their idea. I always like to stress the idea for a vaccine does not start with a pharmaceutical company. It starts usually at a university or in a research laboratory at a university or medical center. The next step is proof of concept or kind of the preclinical phase. And that's when scientists test on small animals, ensuring that there is a robust immune response. And then they go to testing the vaccine on humans. So I will show you more on that on the next slide. Step 4 is the manufacturing process. So that is when the FDA ensures that each batch of vaccines are consistent compared to each other, and that the facility where they are being made meets all the quality safety standards. Step 5 is approving the vaccine. That is when the FDA looks at all the data and they sample each batch and looking at purity of ingredients and potency, just making sure that there is an immune response that we want to see from that vaccine. Step 6 is recommending the vaccine for use. And then step 7 is monitoring safety after approval. So then we look at the stages of clinical trials. And as you can see from phase 1 to phase 4, these are controlled studies looking at both dosing and effectiveness, but just in larger populations as they go along. I do always want to stress as well, talking about the COVID vaccine, prior to the COVID-19 pandemic, like we had already talked about, they were already doing studies regarding the mRNA vaccine. So there's already research being done for a vaccine for coronaviruses. So the COVID-19 vaccine was so quick because the 3 phases overlapped instead of going one at a time. There wasn't just one vaccine going through a trial. There were several vaccines being studied. And where there's typically a 1 to 2 year gap between each phase, all the trials were planned at one time. So the same amount of people were still involved in each phase and no phase was missed. The phases just overlapped at times so that we were able to get a vaccine out that could effectively provide people immunity from COVID-19. This site is a little busy, but it kind of just goes back to with showing you how many people from phase 1 to phase 3 are involved in clinical trials before the vaccine comes to our office. I'm just for time, I'm not going to show this, but it's on the World Health Organization, but it just is showing the manufacturing process, how the batches are checked and then stored at, a certain temperature before they're here. They're delivered in coolers before they get here, and everything is monitored closely to ensure that the vaccines are safe until they get to our office. Oh, I wasn't going to show it. Sorry. Okay, moving on. So with vaccines, they are constantly being monitored for safety and side effects. 3 times a year, the Advisory Committee on Immunization Practices, or the ACIP, meets to review vaccine effectiveness, safety data, and clinical trial results, and also looks at outbreaks of vaccine preventable diseases and vaccine shortages. Okay, Lindsay is going to take over in just a second. I like to show this timeline as well, and want to reiterate that vaccine preventable diseases have been around for thousands of years. If you have time and you want to, you can read Hippocrates. He has several works titled Epidemics, where he describes epidemics of mumps, diphtheria, and jaundice. So it's important. There has not been an increase in disease. These diseases have been around since the 5th century. And as long in the early 1900s, so about 100 years ago, children were dying from diseases, suffering complications or permanent disabilities from diseases that are now prevented by vaccines. We don't see these diseases anymore, not because they magically disappeared, but because vaccines are so effective at providing immunity and preventing harm. There's a lot of things missing on this timeline, such as the Edward Jenner in 1796. Oh, that one's up there. Okay, that's a smallpox. 1879 is when we had the first live bacterial vaccine that was created in a lab. And then the first viral vaccine in 1884 was for rabies. And then 1955, we have the polio vaccine from Jonas Salk. And those are kind of the big ones. And then, yeah, it does show 2007, the first study of mRNA vaccines as well. All right, I'm gonna hand it over to Lindsay. Oh. Hold on.
All right, so the first vaccine preventable disease that we're going to talk about is RSV. This is actually a picture of Casey's daughter who had to be hospitalized overnight for RSV. We both can confirm that having kids with RSV is awful. So we are really thankful that now we do have a monoclonal antibody, as Casey talked about. RSV is very common, and it is one of the most common respiratory infections to cause hospitalizations in infants. But again, with the monoclonal antibody, we're preventing about 80% of infants infected with RSV from needing medical intervention, so coming to our office, and also greatly decreasing the need for hospitalization as well. And what's cool about this, as Casey mentioned, we can give an antibody injection directly to the baby, or if mom gets the RSV vaccine between those kind of last few weeks of pregnancy, at least 2 weeks before delivery, that passive immunity is intact during that first RSV season. So you'll notice after each vaccine preventable disease that we discussed, there's a little table, and we put disease risks and then the risks of the injection or vaccine. If there's a combined vaccine, then the vaccine risks are the same, but the disease risks differ depending on what disease we're talking about. And in the majority, if not all, you will notice that there is significantly more listed on the disease risk side than the vaccine side. So the next disease we're going to talk about is rotavirus. So it's the leading cause of death from diarrhea worldwide. Here in our country, typically if kiddos get rotavirus, then and need hospitalization, it is for hydration purposes. So really the only way to get rid of rotavirus is to let it get out of the belly, and to go in for hydration IV fluids as needed. But this vaccine, which is an oral vaccine, so we're sending it right to where we want to fight the virus, helps decrease the hospitalization rate by 80%. You can also see on all of our vaccine slides, we do have the amount of doses and then the typical ages where we give the vaccines here at our office. So the next vaccine preventable disease, sorry, Christy, I'm clicking fast, is polio, which was eliminated from the United States in 1979, but it is still around worldwide. It is a highly contagious virus, and people can still spread the disease when they are without symptoms. This is the virus that starts in the gut, travels to the blood, and then can cause neurological complications like paralysis. And again, we use the inactivated type. There is an oral that is used in other countries. So hepatitis B is a viral infection that affects the liver. It is 100 times more infectious than HIV. So it is most commonly associated as a sexually transmitted infection or in fact blood and body fluid, so mom to baby, but it can be spread through casual contact. So if you have broken skin and there's sharing of any towels, washcloths, anything like that. And the younger someone is when they're infected with hepatitis B, the more likelihood that they'll have chronic issues later in life. Then hepatitis A, you can see this little guy is like a little glowworm. So jaundice, because this also affects the liver. The humans are the only reservoir or people who host, thank you, with Hep A. But so it is due to ingesting fecal contaminated food or water. So you hear about a restaurant outbreak. So somebody who may or may not even know they have hepatitis A because they can transmit the disease 2 weeks before their symptoms start, doesn't wash their hands well, is dealing with your food, other people eat the food, and then it becomes a community outbreak. And this is typically a self-resolving viral illness, usually 2 to 6 months at max, but you still can have all of the complications of liver disease. So diphtheria. This actually, diphtheria starts our next combination vaccine that we're going to talk about, which is DTaP, so diphtheria, tetanus, and pertussis. Diphtheria is a bacterial infection that most often causes respiratory complications. Basically, there is a membrane that can form within the upper airway and cause upper airway obstruction, difficulties breathing, but also, as you see, heart and nerve problems. And again, this is really important to vaccinate against because fully immunized people may be without symptoms or have just a mild sore throat, which in February in Indiana, we're attributing to anything else besides diphtheria. And then you'll notice too, so our little kids get DTaP, and then typically our young adults, preteens, teens get the Tdap, or you can just get a TD booster. Next in that series is tetanus. So again, that's the T in the DTaP vaccine. This is also a bacterial disease, and it is not transmitted person to person. It is only in the environment, so we will never be able to fully be without tetanus. And if you look at where tetanus is present, this bacteria, these spores, it's in soil, it's in dust, it's in poop. It can be where our kids are playing. And I think that is something that is really important to remember. And often they have scrapes and cuts on their hands and feet, and they're in the dirt, and then they can have the exposure. So these spasms that tetanus can cause can be to one part of the body all over, or it can affect the nerves. So again, receiving one dose does not give lifelong protection, and we recommend a booster every 10 years unless there is a known exposure. The last part of this DTaP is pertussis, so whooping cough, or it's also called the 100-day cough. So the bacterial component of the pertussis causes this coughing that is pretty much uncontrollable, and a lot of phlegm or mucus that goes along with it. And then you hear these kids mostly make these whooping sounds between their coughs. This is probably the second most contagious vaccine preventable disease we have, and 8 of 10 non-immune people will be affected with exposure. And just to highlight that, it's often misdiagnosed or underdiagnosed in adults, which is, again, just highlights the need for vaccination and booster vaccines for moms, as that can prevent 78% of cases of pertussis in infants less than 2 months and prevent 90% of hospitalization if they do become infected. So boosters are important. And then this highlights the DTaP vaccine that we just talked about. So our next combination vaccine that we're going to talk about is measles, mumps, rubella, or MMR. This is a picture of the measles rash. Obviously, we do know it's kind of a hot button issue right now with there being an outbreak in our country. This is, as we talked about, very, very contagious. And unfortunately, today it came out that the United States has had the first death from measles since 2015, and it was in a school-age child who was unvaccinated. So there's, mild complications. You can talk about ear infections, things like that, but this is a really serious disease. And then something specific to measles, and it's one of those arguments against kind of natural immunity, is that measles can affect long-term immune responses to any other disease because measles has a role in affecting the white blood cells that are a major component of the immune system. So immune amnesia is what's that's referred to as. And then there's mumps, the second M in the MMR vaccine. So before vaccination, it was the most common cause of meningitis and acquired deafness. And obviously, it can cause some painful swelling of the salivary or parotid glands there in the neck and jaw. But again, the most common complication is the meningitis or the swelling of the brain and spinal cord. Okay, the R in MMR, rubella. It is also known as German measles. Let's see here. So it has been eliminated in the United States with the initiation of the vaccine series. And again, before vaccination, causing hearing loss, congenital heart defects, developmental deficits. It is highly likely that if a pregnant woman were infected with rubella, then her developing fetus would have birth defects. So the vaccine has prevented those from happening. Okay, chicken pox, varicella. So, most of us had chicken pox, depending on when you were born, because the vaccine was approved for use in 1996. So starting from then on, we've been able to prevent kids from having this awful rash and the associated discomfort and symptoms. But even more importantly, we prevented 1 to 2 children in the United States from dying from chickenpox because before the vaccine, that was occurring. So measles, mumps, and chickenpox are all viruses that can cause viral meningitis as well. And so it's just really great that we can prevent chickenpox, but we can also, I think we're starting to see now that we're also preventing shingles or the severity of shingles down the line. Okay. Then Haemophilus influenza type B, or HIB. Before the introduction of this vaccine, HIB was the leading cause of bacterial meningitis in children less than 5. And the incidence of HIB disease with the introduction of the vaccine has decreased more than 99%. So again, we talk about that meningitis. H flu or H influenza, this does not cause the flu. It can cause similar symptoms like ear infection, but again, serious things, meningitis, epiglottitis, which is a swelling of the throat, cellulitis, other more serious infections. All right. And then the pneumococcal vaccine prevents against many different strains of strep pneumonia, which is the most common cause for ear infections every year. And this is the one that Casey was talking about with the invisibility cloak, that kiddos less than 2 cannot develop natural antibodies. So by giving them something they can, then we're able to prevent these other things from happening. It's also gotten tricky and is become more resistant to antibiotics. So that's why vaccination is even more important. You will see that the pneumococcal pneumonia vaccine is the most reactogenic or has the highest risk of vaccine side effects. But again, when you compare and contrast, there's a lot more serious things on the disease risk side, and the other things can be managed and are not life-threatening. Human papillomavirus, or HPV, is the most common sexually transmitted infection worldwide. So it can cause anal and genital warts, and also cervical, anal, vaginal, vulvar, penile, and oropharyngeal cancers from many different strains. So, and then infection with one type of HPV does not prevent infection with another type. I think it's also really important to point out this is not just a vaccine for girls. More than 10,000 men were diagnosed with cancers of the head and neck stemming from the HPV virus. So this is important for everyone, and it prevents 9 out of 10 HPV infections. And it was also completely effective at preventing persistent infections and pap smear changes that predict cervical cancer. This is the only vaccine that we have that prevents cancer. Okay, meningococcal. So obviously this is, I don't know about obviously, but it is related to meningitis. So there's a viral and a bacterial meningitis. Viral is most common and often less severe, but we're vaccinating against bacterial meningitis here. So you can see that the risk for infection increases for less than 1, and then again at 15 years of age. So we're giving our first meningitis around middle school, and then we're giving a booster and then a meningitis B. So while adolescents and young adults are less likely to become infected, they are more likely to be affected by permanent consequences of the disease and death. And then obviously on there, you can see that college freshmen in dorms are 5 times more likely to contract meningitis than those who do not reside in dorms. So we try to give that men be especially, 6 months to a year before they leave for college, so that we're at peak working when most freshmen are in dorms. All right, so the last vaccine preventable disease that we're going to talk about is influenza. So there are multiple strains that an annual vaccine covers. I think there were 3 this year. Sometimes there's 4. It is updated twice throughout the year. And again, harking back to kind of our protecting others, getting vaccinated reduces the risk of your illness, the severity, the duration of ill symptoms if you were to get the flu, but it also protects those around you because it decreases your ability to transmit the virus. And we say flu before boo. So before Halloween, get your flu shot. Okay, so I think now we're going to kind of address common questions that we have, and then hopefully we can leave some time for any additional questions that you guys might have.
Okay. So these we added to the presentation just because these are probably the most common statements and or questions that we hear from parents when we talk about vaccines in the office. This one is, I don't want to overwhelm their immune system. Sometimes we have a kid who comes in with like I don't want to say just a cold, but a cold, runny nose, congestion, no fever, lungs sound fine, but parents are still concerned. Or sometimes parents will say, I don't want to overwhelm their immune system. I want to give one vaccine at a time. But hopefully we kind of learn like vaccines do not overburden a child's immune system. We talked about how the number of antigens has decreased, and vaccines only use a very small portion of the memory, immune system's memory. And I think it's also kind of to put it in context, if you think of once a baby is born, they're going from a very sterile environment, and then they're born into this very dirty world. And since the day of their birth, they are constantly exposed to things that are challenging their immune system. So by the time they come to their 2-month visit, the amount of antibodies that they have already created is very minimal to the antibodies that they're going to create from the vaccines that we give. Why do they need so many vaccines? They already had this one. That kind of goes back to depending on what type of vaccine it is. Some vaccines need a booster shot. And this just goes from them studying and looking at the effectiveness of the vaccine. If they give one vaccine, does it provide enough of an immune response? And the studies, with all those clinical phases, phase 1, phase 2, phase 3, if they find that one vaccine does not produce enough of an immune response, maybe they need to do 2. This is something Lindsay and I had kind of come up with, but sometimes we explain it more to kids. Like you think about like your cell phone needs to be updated all the time to make sure that the software is working great. It's kind of the same thing with vaccines, right? You get another vaccine to make sure that your software is up to speed. So basically just that your immune system and your memory cells are ready to go if they're ever exposed to a pathogen. I want to do one vaccine at a time. That one is very common. There's a schedule that's set forth from the ACIP, from the CDC and what the American Academy of Pediatrics looks like, and it's there for a reason. So when you discuss changing it, you have to think about, are you putting them at risk of disease? So if you choose not to do, the rotavirus vaccine, that vaccine you have to do before like a certain time, or else by the time they're 8 months, then they can't get it anymore. So then they lose the chance of getting that vaccine and getting those antibodies against that pathogen. Or if you move out the DTaP vaccine and they're exposed to someone, I don't know, your grandparent who didn't get their Tdap and then they get whooping cough. So, the schedules again are there because they show they are safe. They are the best chance of your child being safe, as they continue to grow. So basically waiting increases time of susceptibility. You can jump in here too if you have anything else to say. Vaccines aren't necessary. Obviously, our whole purpose of doing this presentation is because of vaccine hesitancy with social media, with the internet. So many things are out there. There are a lot of anecdotal, I would say, like, I don't want to say evidence, but anecdotal stories about things that happen with vaccines. I have, as a provider, have never seen measles. So, I could easily be like, oh, measles isn't around, or I have seen pertussis. I've never seen diphtheria. So it'd be easy for me too to say, those diseases, they're not here. Polio's not here, not a big deal. But again, we live in a world too where everyone travels, and I don't really want to take that risk, and I don't want my child to have that risk when I know that they can be provided something safe that is going to give them immunity for childhood and into adulthood. And we kind of I heard a lot during COVID from people like, if I get COVID, I have natural infection. I don't need the vaccine. So you could make that argument. But think if we look at something like measles, that's not a great argument. And for a lot of childhood diseases, I don't think that argument works just because of how dangerous some of these diseases are. And a lot of things that Lindsay and I talked about too is just, it's still stressful for a child to be hospitalized. It's stressful for the family, for your child to be hospitalized. They miss out on going to school. They miss out on so many things. It can affect their development. So even though your child doesn't die from one of these vaccine preventable diseases, it can still significantly affect them as a child and, again, growing into adulthood. Vaccines have too many side effects. We do see side effects to vaccines usually in the office, just local side effects. So pain, redness, swelling. Every time my son gets the flu vaccine, he has a large red circle on his arm that is there for several days, and it is just expected. But he has also never had influenza, and he's 9 years old. So I will take that. There are systemic side effects. Those typically are fever. But when there is a fever, that is your immune system working and your immune system creating antibodies. So we actually expect that and are okay with that. Vaccines cause, I have actually had a parent say this to me verbatim, vaccines cause autism and I don't want my child to become autistic. I don't have them listed, but you can go to, again, Children's Hospital of Philadelphia. If you haven't guessed by now, is one of my favorite websites. But there is a list of all the studies that have been conducted regarding at least autism and vaccines. But also there's things about SIDS as well out there, neurological disorders. But there's a lot of good research that show that there is not any correlation between vaccines and these events. Again, Dr. Paul Offit talking about vaccines, but you can watch that on your own time. I will stop that. Yep. Okay. You want to do final thoughts? Sure. Okay.
So obviously, we're very passionate about vaccines and the benefits that they provide to kids in our community. But what we really want is them to be able to grow and thrive and learn and just do the things that they're supposed to do. So when we prepare their immune system to fight these contagious diseases, we're not worried about them, being hospitalized, not having the opportunity to go to school and be with their friends and do all of these things. And we're thinking about the kids that we vaccinate and the kids that they are around that are unable to be vaccinated for any reason. So this allows every child the opportunity to grow, learn, and thrive throughout childhood, and they can just focus on being kids.
We'll add to that too, just with the measles epidemic, with the importance of herd immunity. You're not vaccinating your child just for you, you're vaccinating for other people in your community. So, it's important just to think of other children and not just your own child. I think that is it. So we will take questions now. First, we'll take questions in person for the two people who came in person while everyone else stayed on Zoom. You guys don't have any questions? Okay. And then we'll take any questions from Zoom. You guys are welcome to stay for the questions if you don't want to.
One question. I don't know if you want to read it.
Sure. Okay. How long do antibodies last in our babies? Regarding the measles outbreak, for example, I got my MMR on 9/12/24, and my baby was born on September 9th, 2024. And now she's 6 months old. It is not recommended to get her MMR until she is 1. Is that because she still has my antibodies in her until a year old? And how do we know this? I got my MMR. Sorry, I'm just rereading. Oh, yeah. Yeah, I got that. I was trying to figure out when she got hers. Okay, yes. Yeah, okay. Yeah, maternal antibodies only last for 2 months. But if there is an outbreak or we know you are traveling to a place where measles has been identified, we can give the measles vaccine as early as 6 months. But then that means at 12 months, they still need to get that first, it would be considered another first dose, and then they would get the booster dose at 4. I guess, how do we know this is from scientific studies. If you would want to message one of us, if I guess I could give someone's email, I could find a specific study for you. I just do not know off the top of my head unless Dr. Frayne knows. Okay, no, okay. But yes, I'm sure that there is something out there from, when they did the clinical trials that showed that. Does that answer your question, Jessica? Yes. Okay, great. All right. Any other questions? I know you recommend the CDC schedule, but does that include a COVID shot at 6 months old and then one a year after that? I know that's a new one and didn't know if that was a requirement to be a patient in your office. Okay, great question. We do recommend it. It is included on the CDC recommended schedule. And again, like I had mentioned, 3 times a year, there's a meeting between where the ACIP meets and they review vaccine safety. They review, dosing, outbreaks to see if that needs to remain on the recommended schedule. And it currently is. You are not required to get the COVID vaccine. You will be asked every year if it is something that you would like, because we do encourage it. If you decline to get it, then we also ask that you just sign why am I blanking? A vaccine refusal form, just showing too that you understand the risk of your child not getting that vaccine, and just reiterating that is what we recommend. But yes, you do not need to get it to be a patient here.
And that goes for influenza as well.
There are 2 other vaccines that are recommended but are not required to be patients in our office, and those are the influenza vaccine and HPV vaccine. Well, that's a good one. Why are titers not drawn as a routine lab to make sure we are protected? That is a very good question. We actually have drawn titers on several patients here. I, off the top of my head, know a family who got 1 vaccine of the varicella, just for example, for like the chickenpox vaccine. So they had the chickenpox vaccine, the first one, but then they never got their second one. And the child was now, I believe, 9 or 11, and they, needed to get that vaccine to stay a patient. And we did draw a titer and found out that they did not have, a strong enough immunity to that. And so they were required to get it. But they, chose not to. But that titer did show that they need to do it. So sometimes we will, if we are concerned that they are not, they don't have immunity. But again, that's, one that would be costly and would also cause distress to a child if every single, year, they would need to get a titer drawn just to ensure that they are protected. Does that answer your question, Jessica? Oh, yeah. And you are welcome to always ask if that is something that you're interested in. Again, because that is something that we have done. I know at least for 1 patient that I know of, but I'm sure for other patients that's also been done as well. Thank you for this study that someone has posted. I'm going down to other questions. Okay. John Christopherson, do you have any specific questions? Or are you just posting studies?
So the question is, can we get this PowerPoint handout to use as a reference? So I don't think we have it available yet to hand out, but we do in the office have vaccine information sheets, VIS, that tell a significant amount of what we said, but in a very patient-friendly form. And so
if there's anything specific that we went through that you want to look back at the slide, I'm welcome. I'm happy to go back if you want to look more at some of the slides, because I know we moved fast through some of them. Okay. Sorry, the next question is hold on.
And I think this will be our last question.
How many children are in your practice, and how many doctors or practitioners are in your practice? We have a website. That is all on our website. We will do one more question. Our website is fortwaynepeds.com. Thank you. So this question, I'm not sure if I am going to answer it but if one of our doctors would like to answer it, they can. If not, if you want to leave your information, they would be happy to reach out to you. The question is, what is your office doing with misinformation about vaccinations in our political climate? And if RFK mandates that vaccinations aren't needed, how will you protect against infection in the office in regards to your vaccination policy? So I think the biggest thing that we're doing right now is this presentation.
And Dr. Kristen Frayne.
Dr. Frayne wants to intervene.
So we are actually part of the Indiana AAP board. So there are several members that help to kind of advocate for change for children in Indiana. And so we are all active members, and then we have members of us that are on the board. So we care deeply about all of our children, and so we do so in that way.
Oh, thank you, Jessica. And thank you everyone for being on the Zoom and in person. We appreciate it. This is our first presentation. We hope there will be a link to the feedback form on our website, correct?
Yeah, it's on the website, and
okay.
We can send it out too.
And we can also send it out. Because you're registered on Zoom, so we can send, and it's just saying what you liked about the presentation, how helpful it was, what can we improve, what more do you want to know about. So thank you all so much for being a part of it, and please talk with us or your doctors at your next appointment if you have any further questions.
Thank you.